I just want to pick up on the point that Andrea made just before she moved into the slides of the wonderful new buildings we've got in Bristol. And ask you to cast your mind back to the cartoon and ask you if you think that looks like a simplification. The analogy of the racehorse and the camel comes to mind, and my role as a director of commissioning locally, working for NHS England, is to absolutely be working in amongst those boundaries and try to create some synergies between commissioners. I just want to say a little bit more about what commissioning is. The animation talked about commissioning being choosing and buying, which is true. But if you think about going out to choose and buy something, first of all, you have to know what your need is and what it is you're trying what need you're trying to meet. And part of commissioning is starting with a really deep knowledge of the population that you're commissioning for. What are their health needs? What needs to improve? And buying services that meet that need. And I kind of hope this is true, but back in the day I was told that in Salford, if you go back 20 years, they had a fantastic dermatology department in the Salford Hospital, sort of, tens of world-class dermatologists, but it was in the place in England that had the worst coronary heart disease problems in the world, and there was one. So I'll look at Peter. It might not be true, but it's a kind of good, whether it's true or not, it's a good analogy for why you need planning and commissioning to make sure that you buy the right services to meet the needs of that population. And so the other bit of context I think is worth noting, probably for the whole weekend, is that the amount of budget that is given to commissioners per head of population adds up to about £2,000 per head per year. So that's for all of your GP services, all of your dentistry, that's the NHS, your maternity services, every time somebody goes to a hospital, and right through to some of the people that we commission services for can be up to hundreds of £1,000s a year to pay for the cost of that treatment. So the commissioning process is necessarily always a balancing act between what can be done and what creates best value for the whole population. And I want to just want to talk a little bit about the advantages of NHS England having a single commissioner for the whole of England. It's the first time we've had this. This is the biggest NHS organisation there's ever been across the whole country, because before it was always chunked up into health authorities and smaller units. And so we've got, I think there's three areas where I'd really draw out an advantage to that complex picture. One is in primary care, actually, Martin, because for the first time you've got an organisation with enough purchasing power to say, what does modern primary care look like? And it's not left to local initiatives, which could be, sometimes a big change can be difficult, can't it? And if I'm honest, I think that we are going to see more and more practices joining up and creating bigger units so that we can provide on the, in the suburbs and on the high streets the services that we need to pull out of the hospitals to allow the hospitals to do the really complicated stuff. So I'm not so sure, I don't know, if I say this you're going to think I'm labelling things, but I'm not so sure that the primary care of the future can continue to be run out of converted three-bed 1930s semis. That's not what it needs to look like in 5, 10, 15 years' time. It needs to be you need to feel like you're walking into more of a clinic with lots of doctors, lots of nurses, lots of physios, etc. It's definitely been an advantage with specialised commissioning. A lot of services provided here in Bristol, but we also commission services from across the whole of the southwest, burns, brain surgery, things that thankfully don't happen very often, but when they do, the services need to be right. And what we've got with NHS England is the services coming up to the same standard across the country, so that when you get one of those, if you got one, unfortunate enough to have the need of that sort of service, you'd have the choice of the same standard and the same intervention, whether you're in Penzance or Newcastle. And I think that is a real advantage. I also commission services into prisons, actually, and into the justice system generally. And having a single commissioner across NHS England has really given the profile to those services that they need. And I'd say that's probably at the moment, in October 2014, I think the biggest advantages we've seen is into buying better services into what was a bit of a forgotten part of the system. There's obviously some disadvantages from that fractionation that you saw up there. I think part of NHS England's disadvantage might be speed and the distance from between members of the public and where the decision making happens. So that's obviously an issue which we might want to explore. We've also, sadly, we have to work to overcome linking what I buy to the population needs. So we've kind of managed to uncouple an understanding of population need from what we're buying from hospitals. We're just we're focusing on the standards, but we're not so much focusing on the gaps. And do people in Cornwall get the same services as people in Bristol? We have to work quite hard to marry back up the data. We've gone, we keep talking about integration being the holy grail for services. We keep making it harder and harder. So first of all, we uncoupled providers, and now we've uncoupled the commissioners, and actually there's some perverse incentives in the system. So I buy the weight loss surgery. Martin buys the early weight gain prevention and services, and the local authority is responsible for making sure that our communities are accessible and we've got access to places where we can do exercise. And there's no correlation. There's no, if Martin chooses not to buy any early intervention services for weight loss, that's fine, because I just have to buy the surgery. So we can create that. It's not happening here, I'm happy to say. That's why it's a safe example. But there's that potential for some perverse incentives in the pathway. So, one commissioner can save a bit of money at the expense of somebody else, but that's not necessarily the best thing for the population. And so I think the other thing I wonder about NHS England, and this comes back to Andrea's last point, is about the flexibility and the freedom that a national organisation allows people like me to offer to people like Andrew and Martin in doing something radical locally. We tend to be a bit more limited in terms of having to follow through on a national policy. But we've got some examples locally. In Somerset, we've done something with the GPs, which is a bit different. And we continue to look for those opportunities to stimulate and allow for local innovation.